How to treat and cure Down syndrome. It is common to experience a wide range of emotions when your baby is born with Down syndrome. While you have joy from your child's birth, you will also need to learn about and care for his or her special healthcare needs. Most families choose to raise their child, while some consider foster care or adoption. Support groups and organizations can assist you in making the best decision for your family. Treatment for Down syndrome focuses on making sure that your child has regular medical checkups, helping your child develop, watching for early signs of health problems, and finding support. With treatment and support, you can help your child live a happy, healthy life. Get your child regular medical care. You can help your child stay healthy by scheduling routine checkups. This will help to identify, manage, and monitor any diseases and health problems that people with Down syndrome have a higher chance of developing. Doctors look for specific problems at various ages, such as cataracts and other eye conditions during a baby's first year. These checkups are also a good time for you and the doctor to talk about any concerns you have. Many parents have similar concerns as their children grow, including newborn concerns, such as where to get emotional support and learn about Down syndrome. Infant concerns, such as what therapies your child may need and how to prevent colds. Early childhood concerns, such as how to teach healthy behaviors, social skills, and diet and exercise. Middle and late childhood concerns, such as how to support independence and education, and what team sports your child can play. Adolescent and young adult concerns, such as what to expect during puberty and adulthood. Help your child to develop. Although it may take extra time for your child to learn and master skills, you may be surprised at how much he or she will be able to do. With encouragement, your child can learn important skills. You can help your baby learn to walk, talk, or eat by himself. You can help your child make friends and do well in school. Later you can help him or her learn job skills and maybe live independently. Get treatment for health problems. Your child may develop health problems related to Down syndrome, such as ear infections, dental problems, or behavior issues. He or she may need medicines, such as antibiotics for ear infections and thyroid hormones for an underactive thyroid gland, hypothyroidism. Surgery to correct problems such as heart defects, bowel obstruction, or spinal problems. Different types of therapy, such as speech therapy, nutritional advice from a registered dietitian, or counseling for behavior problems. Families of children who have Down syndrome may need other types of resources, such as financial assistance. Children with Down syndrome have special needs that may create additional expenses for the family. Some state and federal government services help cover the costs of certain programs. The amount your child receives depends on different things such as your income and your child's level of disability. To find out about financial assistance in your state, call your state's Department of Developmental Disabilities. Estate planning. Become familiar with tax issues and estate planning to ensure that your child will have proper care and necessary resources available if you die. Family counseling. This therapy involves regular sessions with a qualified counselor who has experience working with families who have children with Down syndrome. It's also important to take time for yourself. Common frustrations and frequent highs and lows can all lead to exhaustion. Take good care of yourself so you have the energy to enjoy your child and attend to his or her needs. For more information, see the topic Caregiver Tips. Therapies and development. Early intervention and many other therapeutic services are offered to people with Down syndrome, and the articles in this section are merely overviews and suggestions. All children, whether they have Down syndrome or not, develop at their own pace. Always speak with your child's doctor or therapist before starting any new therapies. Early intervention. Details on how early intervention therapies can benefit a baby with Down syndrome, the various kinds of early intervention available and how to access services. Alternative therapies. Alternative therapies include a wide range of theories and treatment practices. Parents should discuss any potential new treatment with their doctors to learn more about any known benefits and side effects. Physical therapy and Down syndrome. The goal of physical therapy is to facilitate the development of gross motor skills such as good posture, proper foot alignment, and a good foundation for exercise throughout life. Medical treatment for Down syndrome. There's no medical treatment for Down syndrome itself. However, anyone with Down syndrome is at increased risk for other medical problems, although some never develop any. Common medical problems faced by people with Down syndrome include heart defects and thyroid, muscle, joint, vision, and hearing problems. Conditions seen less often in Down syndrome include leukemia and seizures. A number of different approaches are used to treat these medical conditions. Medications. Medications are used to treat some of the medical conditions that can accompany Down syndrome. For example, a person who has a seizure disorder may be given an anti-seizure medication, and someone with a thyroid problem may take medication for thyroid hormone replacement therapy. Medical and other specialists. If your child is diagnosed with Down syndrome, your pediatrician is the main healthcare professional for managing his or her medical issues. Surgical treatment for Down syndrome. Congenital heart defects. About 40% of children with Down syndrome are born with these defects. Some are mild and may improve on their own, but those that are more severe typically require surgery. Gastrointestinal defects. About 1% of children with Down syndrome are born with tracheoesophageal fistula, which causes choking and bubbling up of milk or formula. From 2% to 15% are born with Hirschsprung disease, which causes large intestine dysfunction. An estimated 3% are born with imperforate anus, in which the anal opening is not present. For Down syndrome, there are two types of tests, one tells you the baby's risk, and the other diagnoses Down syndrome. Screening tests. Combined first trimester screen. This test is usually done between 9 and 13 weeks of pregnancy. Second trimester triple screen. This blood test measures hormone and protein levels along with estriol, a hormone made by the mother and the unborn baby. It's about 69% accurate. Second trimester quad screen. This blood test combines the triple screen with a test that looks at another hormone made by the placenta called inhibin A. Integrated screening. This includes the combined first trimester screen and the second trimester quad screen.